I've been often asked by clients after they've had an awesome experience with this work, how I got involved in it. How did I know how to go this direction and all of this and all of that? Well, I'm going to share that with you in this video. In the first video, I talked to you about the foundations of this work. In the second video, I talked to you about how to get it into your hands. In the third video, I talked to you a little bit more about how to take the client or the patient into a deep, relaxed setting. So it all started back. Let me just back up when I was a child. I used to have migraine headaches really, really bad when I was young, in about third grade. They were headaches that would come once a week, and I would have them for about 3 hours, and they would be 3 hours long, or if I could empty my stomach 3 times. So it would almost always worked out that 3 times that I would have to empty my stomach would be 3 hours, and then I felt fine after that. Later on, it seemed that I developed an incurable liver disease, which nobody knows where it came from. It was something that I was put on medication for, and it seemed that things got better because the tests that they did, just testing a few things in the blood and everything else, always seemed normal. So I was kept on cortisone for about 7 years, at which time I went into a free clinic to get my prescription refilled after I'd left home. And the doctor there was just startled beyond belief that I was asking for more cortisone. So he took me back in his office and said, "How long have you been on this stuff?" And I told him 7 years. He nearly fell off of his chair. Now this guy was in his residency, so he couldn't really do anything for me other than tell me some things about cortisone, which was, you need to get off it very slowly, you need to get off of it, but they don't know if the body can come back up after that long of time, because he feared that my entire endocrine system was gone. Well, there's a lot of things that I did between the work that I've discovered now and getting well from that, and which involved plant-based medicine and things like that. But having that experience of going through so much with my health, and at the age that I was, because I was in my early teens, 12 to 14 years old, and I realized that I had a lot of emotional issues because of that, because I missed out on so much of the developmental stages of my life. So I left home about 18 years old, and 19 years old I went into a free clinic to get my prescription refilled, because I was told I had to stay on that medication the rest of my life. This free clinic doctor was in his residency, so he couldn't become my physician and work with me on it, nor would his license allow him to do that. But he did guide me in a very, very godsend way, because he told me that cortisone was very dangerous on the body. It would probably take out my endocrine system, which is what he feared. But he said I really had to get off of that medicine. I couldn't do it quickly. He sent me to another doctor that was in practice, and that doctor basically said, he basically threw up his hands and said, you know, there's nothing that he could do for me, so I was to just go home, take my medicine, and if I lived another 10 years, I should be happy. Well, at my age and kind of my spirit, I was not going to settle for that at all. I was not going to be a victim of that. So I wandered into a little health food store that there wasn't very many of them out there then. It also had a little herbal store close to it. And I looked at this bookstore in this bookshop that was in this kind of little place. And there was only one book about herbs that was in this entire book. There was hardly anything about alternative care at that time. So I looked at the book. I sat down on the floor and I looked at the book, and I saw there were so many things that was going to help the liver. I was just absolutely amazed by all of that. So I decided to pick out a few herbs and then look up the herbs in that book, and I decided which 3 probably best fit what was going on with me. I bought the herbs, And then I went and filled my prescription, and I laid everything out on the table and decided I was going to take a year to wean myself off of the cortisone, which I did. So that's an experience that I had with health. That's the experience I had with Western medicine. So as you can tell, I wasn't probably very keen on Western medicine after what had been my experience. So then I went into massage therapy sometime later and realized that massage therapy was pretty cool because it was able to help people with aches and pains and relax them down a little bit. But when people started to come to me with problems with their shoulders, with frozen shoulders, with very severe neck issues and low back pain that was not being helped by just working the muscles, I thought something else has to be done. And about that time, I got a little card in the mail that explained invited me to a cranial sacral class. It was in Houston, so it was close by. And I thought, well, I guess I'll give it a try. I was highly, highly skeptical of the whole thing. I thought it was crazy, actually, at first. But after the 4 days of it, and the final we had to do was we had to work on somebody else in the course. After my experience of having the cranial session by a student, mind you, I was sold completely on it, and I knew that this was the modality that I needed to master. So that's what led me into the cranial sacral work. And then again, as time goes on, because I've been doing this for 35 years, as time went on, I realized that people would come in again with different shoulder issues and things like that, and the cranial sacral therapy would help quite a bit. But there were things I needed to do to the shoulders or to the hips or to the feet or ankles and knees, because they just came to me for all of these things. And I decided that the whole body needed to be aligned, and that's what seemed to be the magic key to all of this work. Hence, I developed this course, and now I'm presenting it to you if you want to be a part of it. The other thing that I noticed is that my parents put me into ballet when I was very young, like 3 years old. And of course, they line your body up and they do all this and they do all that. But it was always such a struggle to hold myself in the right positioning. After having a lot of this work done in my training, I realized that I had a lot more body awareness in different ways because I could feel the alignment so much better. My balance was better. The whole way that I was moving my body was much better, and it was also much more relaxed because I just felt like the alignment helped me to relax my arms, relax my shoulders, and not feeling like there was so much struggle to stay into that proper alignment for balance. So if you are just going into this athletic field or dance field or something like that, and you want to learn more about the groundwork of all of this, this is a course for you also to take. You may not want to get the experience of working on people, but you can also do a little bit of self-care on yourself, and you will get more of a awareness for your body by understanding some of these subtle techniques. By understanding the fundamentals of subtle alignment, you're going to have a different awareness about how you move your body as well. You're going to find yourself sitting differently. You're going to have awareness how you're walking. You're going to have awareness how your shoulders are moving, how you're moving in your sport, or if you're an athlete. So it's a beneficial thing for people to understand. It also would help with understanding why you might have pain in certain areas, and then you'll better understand how you can correct that. Just because you'll be looking at the smaller joints, maybe you have something going on in your foot, you'll be able to understand how the joints are maybe a little bit out. With that technique, you can just bring your foot up to where your hands can reach it and begin to work on yourself that way. So you can also implement this to self-help as well, although there are some parts of your body like your head and your spine that it'll be a little bit difficult to do, but you can also do a little bit more with your shoulders. You could do a little bit more with your hips and your knees and your extremities, which is really, really helpful, particularly if you're in the athletic field of any sort. So in the course, I have a chapter dedicated to self-care techniques. In the next video, I'm going to share with you more about the fascial structures of the body. Bear in mind that the fascial structures of the body have everything to do with restricting the alignment of the body. So it's important to understand that in order to align some of these bones, especially the small bones, you have to go through the fascial structures and make sure that they are functioning at their alignment as well, because they put tremendous restriction and stop a lot of movement patterns when they're not addressed. Thank you so much for watching this video. Be sure if you haven't viewed the previous videos that you go back and look at them, or if you feel like you want to refresh yourself, go back and take a look at them also. And I look forward to seeing you in the next video, so stay tuned and I'll see you then.